We always want to keep you updated on what's going on with a lot of our corporate partners. And over at KORT Physical Therapy, Jon Beougher is on the line with us because it looks like there's going to be a lot of people that are going to be able to perhaps, get some elective surgeries and people can get back into some physical therapy. So, Jon, welcome in. Good morning.
Yeah, thanks for having me.
So what are you guys, I'm sure, are preparing? In addition, we'll get into telehealth in a little bit, but it sounds like we're getting closer to people being able to either have some elective surgeries and thus, as a result of that, get some physical therapy.
That's right. Well, one of the things that we're looking at doing is there's been a lot of people that have had surgery scheduled 5 weeks ago, 4 weeks ago, that was canceled, rescheduled, or delayed. And for those people, there's a lot that they can be doing right now to help make their outcome after surgery become faster, better, get back to life. So we can actually be offering TeleRehab to those people now to help them figure out what to be doing ahead of surgery. We've got this really nice platform that we have that lets us connect via smartphone or tablet or laptop, where we can go in and we can see you and see how you're moving, talk through the specifics of what's going on. We can assess your home environment to make sure after surgery what you're coming home to is set up in a way that's going to help you to heal and rehab as quickly as possible. So that's something that you can be doing now, even if you're not sure when your surgery is going to happen, to make sure you get back to life faster afterwards.
Yeah, it's funny. The job title, like home health therapist, now is becoming a term. I mean, was that something that existed 2 months ago?
It is something that existed for a while, so that's what I actually do. A lot of people that have bigger orthopedic surgeries like a knee replacement or a hip replacement, what happens is that they go home from the hospital really quickly. A lot of times people now go home from the hospital the same day or the next day. So we go out there to the house and see them for a couple weeks at home until they're ready to start getting out to the clinic. So that's something that we're looking at doing right now, following all the guidelines for emergent and urgent patients, to have the offerings available after surgery for people that do need therapy there at the house for a little bit. We can do the home health physical therapy with them, or the outreach program, which is outpatient therapy at home, we can do with them. And before surgery even starts, we can connect via TeleRehab on that same platform to get people started in the right direction.
Yeah, I mean, rehab is something you would think, gosh, that'd be so tough to do on your own. But obviously we're all adjusting to the times, and you've been doing this for a while. But I mean, somebody that's listening, there's probably people that think, well, if I can't go in there in person, I may not be able to do the rehab they want me to do. That's obviously not the case.
It's not the case at all. What's really cool is people's home environment, they often don't realize, because they've never thought about it or had somebody look at their environment to see how they might be able to best exercise. So for me specifically, I've been going into people's homes and doing therapy with them for the last 7 years. So when we think about just a flight of stairs or a floor or a chair, there's a lot of things that we can do to get people working on moving better. And the cool thing about going into surgery makes common sense if you think about it. The stronger you are going into surgery, the faster you're going to recover afterwards. Mm-hmm. So even doing things, say your couch sits a little low and you kind of sink back into it, it's nice and good and comfortable when you haven't just had knee surgery, well, that might make it a little harder to get back out of afterwards. So figuring out, looking at your environment, which we can do through this telehealth platform, we can help you figure out what are the movements you need to be practicing. That's going to help you not only get stronger, but also have better range of motion. And those are the two things we have a lot of evidence to suggest going into any type of joint surgery. If you have that joint nice and loose and you have the muscles around that joint nice and strong, you're going to recover faster.
Do you have any sense of when the type of patients you'll be able to, when they'll be able to come back in, and the type of patients to be able to come back in person first?
Yes, we are following all of the guidelines that have been set out by Andy Beshear, and following the state of Kentucky and everything that we're doing. They've set up some guidelines for what's called the emergent and the urgent patients that can be seen in person, whether that's in the home or in the clinic. So we're following all those guidelines very closely, and we've got a lot of safety precautions in place for those patients coming to the clinic. So if someone's out there is interested, is thinking about doing some pre-surgery therapy with us, whether it's via TeleRehab or wanting to assess if they are an option to come into the clinic or in home, they can connect with us on KORT.com. They can live chat with us during the day between 8 and 5, or you can jump on the website KORT.com and request an appointment, and you can specify if you'd like telehealth or if you'd like to talk with somebody about what patients are being able to be seen in person. We can do that on an individual basis.
Wow. As we talk about this here with Jon Beougher here with KORT Physical Therapy this morning, you've done this for a while, but boy, this is going to be an expanded field for a while and forever. The telehealth in general. I mean, just speak to that, because it's becoming acceptable standard, and once things become acceptable, they become even more widely acceptable. It seems like.
It definitely does, and looking at it now, it seems a little bit overdue. And what you kind of mentioned earlier, in the therapy world, sometimes people think, well, how am I going to do exercises at home? How am I going to do rehab when I don't have equipment? Or how am I going to do rehab when I just have to talk to somebody through the computer? But we are innovating on our end and helping people figure out how to be creative. So from the TeleRehab perspective, the ability to see people move and ask the questions in a one-on-one environment is great. So one of the best things about TeleRehab from my perspective is I've got my patient in front of me, we're one-on-one with no other distractions, and we have plenty of time to get all the questions answered, really assess the movement, and even though we can't put our hands on the patient to do hands-on assessments or treatments, we figured out creatively a lot of ways that we can do those things. In the past, in the clinic, we've always been able to put our hands on people, so we've had to adapt on our end a little bit, but what we found is a lot of success, and my patients that I've been doing the TeleRehab with have really enjoyed it. Right now, obviously, with COVID-19 concerns and precautions, it's nice to know that you can get the essential care that you need without having to have any contact with somebody. But even past that, just the ability to see something that's helpful and innovative where they don't even have to get out of their house to receive the care they need has been really good.
Well, that's it's great, because, again, there's three basic ways. You've got the TeleRehab, the rehab at home, and then in clinic as well that for urgent and emergent patients. So John, it's good to hear, and it sounds, just anything gradual, I think we're all looking for, especially I think progressive we are as well. So we certainly appreciate you guys taking care of a lot of our listeners out there.
Well, yeah, we appreciate the opportunity to talk about it. It's one of those things right now. People are all focused on staying healthy at home, which is great. What people need to be doing now is making sure that they're ready after surgery to be able to get out and about as quickly as possible once they're able to start doing that. So if anyone's out there looking at surgery, give us a shout out at KORT.com. Get on live chat with us, request an appointment, and we can help you out.
All right, John, appreciate it. Thanks so much. Jon Beougher with KORT Physical Therapy. And, again, the TeleRehab, rehab at home, and, yes, in clinic if you're urgent or emergent patients.